some folks on the phone. And we will now review multiple requests with staff member London, starting with mailing F as in Frank.
Oh, hold on.
Staff member running, staff
Wait,
member
wait,
Melvin's
We're on the
being
network.
pulled up, currently experiencing a network problem.
Board Member Patel or Beeman, can you hear us okay?
Yes, I can hear you.
Okay, super. We timed out for a
Board
sec.
Member Hammond, I'm still here.
Okay, thank you.
Staff member running will go ahead as she's getting that pulled up. So this starts the waiver portion of today and tomorrow. And currently we have Baker County waiver requests related to drug security. And we've, at the behest of President Chin, have positioned these or presenting them in such a way that would produce the most efficiency in terms of related topics. So we're not switching back and forth from one thing to the other. And in the terms of waivers, this is a fairly common request. So the request is Baker County School-Based Health Center, CHC 73 in Baker City is requesting a waiver per OAR 855-043-0720 to permit a PA or physician assistant or associate to have a key to the drug cabinet room. In the background, that rule states all drugs must be kept in a locked drug cabinet or designated storage area that is sufficiently secure to deny access to unauthorized persons. The drug cabinet or designated drug storage area must remain locked and secured when not in use. In parent 2, only a physician, clinical nurse specialist, nurse practitioner, or registered nurse shall have a key to the drug cabinet or drug room. In their absence, the drug cabinet or drug room must remain locked. And then here we have the waiver clause here. Upon written request, the board may waive any of the requirements of this rule if a waiver will further public health or safety or the health and safety of a patient. A waiver granted under the section shall only be effective when it is issued by a board in writing. Of note, this is their first request. So as part of the assessment here, number 1, per OAR 855-043-0720 as covered above, will this further public health or safety or the health and safety of a patient? And per Baker County submission, in terms of the need, the physician associate or PA serves as the primary provider and also has dispensing privileges. And parent 2 of the rule does not list the PA as a person permitted to have a key to the drug cabinet. Current staff includes a physician associate and an RN. And in terms of the safety parameters they provided, there's a minimal supply of drugs, no controlled substances. And these drugs are kept in a locked cabinet and only a supervisor has the key. The nurse supervisor is an RN. And they're looking to have a lockbox to store the key so that only the RN and physician associate have access. The RN and PA review clinical policies regularly and on an annual basis. And an MD is the health officer for Baker County Health Department and Baker School-Based Health Center and oversees medication safety and security. So the ask to grant waiver to permit PA to have a key to the drug cabinet, which is a request that we've seen before. The request was approved and the board requested staff to work on updating parent 2 of the rule to include a PA. And the recommendation is to grant waiver to permit PA to have a key to the drug cabinet, effective for 5 years. And President Chen, I'll turn it over to you.
President Chin, thank you. I would like to propose a revision that 5 years is, there's no way that a PA doesn't have ability to do this. I'd like to see it 10 or more years. We've done that on other SBARs of this nature and not have them have to come back in 5 years. What's the length of time until we get the rule change? Can we make this 100 years and call it good?
Staff member running, can we put PRN on it? Does that work or in this situation? No.
So we can go 10, 15, and 20 years then. I think there was one that was 20 years that we had seen back since I've been here. Let's go for 10. Can we go for 10? Any disagreements?
Board Member Kroger,
So-
my only. Go ahead. Board Member Patel, that's the voice from the
This
house.
is Board Member Patel. So quick question. So this is going to be, this waiver is to permit, is going to tie to like just that one physician assistant, because the reason is like, what if you're not there, for 5 years? So, or my question is like whether it's tied to the outlet or whether that waiver is tied to the PA, physician assistant.
So if they were to have a different physician assistant in this physician
Yeah.
associate, sorry, they changed their title. Then it would still hold for the waiver, a physician associate. Whether it's this one or any future physician associated, as the primary care provider in this clinic should be able to access the medications.
Okay, I would like to go for 5 years. But sure, that's me. Thank you.
Is there any other? I'm not gonna die on a sword for 5 years. It's just, for me, these are independent licensees in the healthcare field, and limiting it to 5 years is kind of silly, but
Board Member Kroger, I was just gonna say, I think my only concern with the timeframe and maybe, AG Hunt can weigh in on. I feel like extended times for waivers is rulemaking outside of the rulemaking process, and I don't want to necessarily get in the habit of that, and I don't know what is kind of the like, what's the cutoff, of that. We've made a rule without making a rule because we've granted this waiver for such a long time that it is in the sense a rule now, right? I get that the staff is working on updating it. So in a sense, we are, but that just makes me feel a little.
I just know that since I've been on the board, I've seen longer than 5 years on here before. So that's why I was mentioning it. And I'll rescind my thing. We'll just do it 5 years since there are people uncomfortable.
It's just me.
Well, no, there was some, Ms. Patel, Board Member Patel, so let's just go with 5 years so we can get it going. Is there any further discussion about the 5 years? I don't want to do a round robin if there's not a need to. Okay, hearing no further discussion, is there a motion to move to approve the request as presented for 5 years for Baker County Health Department School-Based Health Center?
So move, Vice President Joyce.
Second, Board Member Greenable. Thank you. Board President Chin, yes. Board Vice President Joyce.
Yes.
Board Member Beeman.
Yes.
Board Member Hall. Yes. Board Member Hammonds.
Yes.
Board Member Kirkbride.
Yes.
Board Member Kroger.
Yes.
Board Member Patel.
Yes.
Board Member Pineda. Yes. Motion passes unanimously. Thank you. Okay, we'll go to the Jackson County, please. That's mailing F as in Frank, number 1. Member Runyon.
Staff member Runyon, thank you, President Chin's mailing F as in Frank 1. This will be the Jackson County waiver request, again, related to drug security. And same rules present here as were discussed previously. So Jackson County Health and Human Services in Medford is requesting a waiver to OAR 855-043-0720 to permit non-licensed staff to have a key to the drug cabinet room. So the difference here is non-licensed staff as opposed to physician associate in the previous case. In the background, as stated previously, only a physician, clinical nurse specialist, nurse practitioner, or registered nurse shall have a key to the drug cabinet or drug room. In their absence, the drug cabinet or drug room must remain locked. there's a provision for potential for waiver below, and this is their first request. And in terms of the assessment, same thing here. Will this waiver further public health or safety or the health and safety of a patient? Per their submission, the need when an RN is unavailable, drugs, including vaccines, need to be received and placed in secure storage. Cold storage temperatures need to be monitored and documented, and after hours temperature excursions need to be responded to. An RN or doctor is not on site 5 days a week, and their current staff includes licensed RNs on site at the public health clinic. There's a 0.6 FTE RN and 1 full-time RN. And again, they do not have an RN or doctor on site 5 days a week. In terms of non-licensed staff, that includes program manager and front desk manager, whose duties include accepting and receiving drugs and placing into secure storage locations, documenting the vaccine refrigerators and freezer temperatures. And they're also on call and must respond to temperature excursions. In terms of the safety parameters they provided, the current medications are Bicillin and other meds for tuberculosis and anthrax exposure. All medications are stored in the same room as the vaccines, which is locked. Only nurses and management have access to the room. And they also have clear policy on medication ordering, inventory, dispensing, control and access, storage, disposal, and training. And that was all provided in the document. So the ask is to permit the program manager and front desk manager access to the keys to the drug storage area in order to place medications received in the secure room when an RN is not available. And this will help ensure that cold drug storage or beds that need cold drug storage comply with storage requirements in a timely manner. And this will also help ensure that they're able to monitor and document temperatures and respond to temperature excursions when an RN is not there. They are not asking to have non-clinical staff dispense medication, just for clarification. So the recommendation here, grant waiver to permit program manager and front desk manager to have a key to the drug cabinet for 5 years, to place drugs in a secured area, track and monitor temperatures, and respond to temperature excursions only. Again, no dispensing is being requested. Or alternatively, open up for board discussion. President Chan, I'll turn it to you.
Thank you very much. You could raise your hand or say something on the phone if you feel like you need a discussion regarding this SBAR.
This is Board Member Patel, and for the consistency's sake, I would vote on no because they're non-licensee. If they're licensee, I don't care. So for consistency, I would say no on for non-licensed personnel to have access to medication. Thanks. Or vaccine.
Any other comments?
Board Member Joyce, yeah, this is a chance for us to practice our standard of care, right? We're offering flexibility based on their professional judgment. So they know, obviously, these people, and they can trust them, and they're bringing us the waiver, saying, hey, we can trust the program manager, front desk manager. So me, there's a need for this. This is a need for this underserved community to allow to be able to provide this level of care. Thank you.
Any other comments?
Staff Member Runyon, while we were reviewing the last waiver request, I did look to see on the proposed rule reorganization recommendation, and this is actually, the CHCs are in the medium priority category. So it would be an opportunity as you continue to further contemplate that list and your input on that before the next board meeting to perhaps incorporate what we're seeing here into any decisions or input that you might have on that list.
I'll go ahead with the motion. Is there a motion to move to approve the request as presented for Jackson County Health and Human Services?
So move, Vice President Joyce.
Member Chin, yes. Board Vice President Joyce.
Yes.
Board Member Beeman.
Yes.
Member Hall. Yes. Board Member Hemmings.
Yes.
Board Member Kirkbride. Yes. Board Member Kroger.
Yes.
Board Member Patel.
Opposed.
Member Pinedo. Yes. Motion passes with Board Member Patel opposed. And we will go on to Planned Parenthood, Southwest Oregon, mailing number F as in Frank 2. Back to you, Board Staff Runyon.
Green.
Staff member Runyon, we'll move on to Planned Parenthood. Waiver request is also about drug security. Circumstance is slightly different here than the aforementioned waiver request. But Planned Parenthood has several locations in Southwest Oregon, Grants Pass, Medford, and 2 in Eugene. And they're requesting a waiver for the same rule, OAR 855-043-0720, to permit their health center managers and health center assistant managers, in other words, non-clinical staff, the key to access the secured medication area. The same role here, parent 2, only a physician, clinical nurse specialist, nurse practitioner, or registered nurse shall have a key to the drug cabinet or drug room. In their absence, the drug cabinet or drug room must remain locked. And this is their first request. And per their submission, in terms of the need, they're currently navigating a staffing challenge, leaving some locations with just one employed provider. They're located in Lane, Jackson, and Josephine counties, making it challenging to ensure coverage for all locations should one provider not be able to make the work. They've had to reschedule patients due to not being able to access medications when a provider calls out. It is not feasible for their operations to function without the managers and assistant managers having access to the secure drug room. They're consulting or continuing to recruit clinicians and RNs, but have been facing staffing challenges for various reasons over several years, suggesting that there will not be a timely resolution of this problem apart from utilizing management as above. And their non-licensed staff is listed there. So we have a health center manager for each location and a health center assistant manager for various locations. And then when asked what duties may have a healthcare manager and assistant manager perform when there is no provider on site. The question was when a provider is not present, or what services will be provided that would require the health center managers and assistant managers to have access to the medication storage areas. And I will note that there were several individuals on the thread when we were communicating back and forth here. Initially, I got an answer that says no services will be provided to patients. Managers need access for inventory management purposes, counting supplies, checking supplies in, and putting orders away, etc. But upon further discussion internally, relating back to their initial request, which did imply that if a provider wasn't able to be present, that patients would have to be rescheduled. That in and of itself would imply that there are patient care related services that are being provided. Otherwise, they wouldn't have to be canceled. And the simple act of checking in vaccine inventory and responding to temperature excursions and monitoring temperatures wouldn't require a mandate that a patient's appointment be rescheduled. So we did receive some updated guidance on that from one of the different individuals on the thread. Just a moment, I'll pull that up. Okay, while we're working on that, I'll continue. So in terms of the layout, please describe the layout of the medication storage areas. And there are 2 medication areas in each health center. A closet where medications are maintained and stored separate from the clinic space. This larger storage area is maintained and locked at all times. There are also cabinets or small closets next to the clinic space that are kept open because a licensed person should be nearby to help monitor alongside the managers. In what manner are the medications accessible? In other words, are the medications accessible simply because someone is on site? They mentioned they need to have someone on site as long as the medications are accessible. So they're accessible by key. The key would only be accessible by licensed staff and health center managers. And when asked if someone on site could be there and not have access to the medications, yes. And the refrigerators contain medications, vaccines. And they have a combination of refrigerators. They have a GP or med fridge with locks. And then they have another fridge that's kept in the locked area. And to go over their temperature monitoring apparatus there. In terms of additional staff, not only do they have RNs, they have NPs, DOs, NPs, WHNPs, PAs, and CNMs. And they provided all of their safety policies and procedures. So the ask is to permit their health center managers and health center assistant managers the key to access the secured medication area for inventory purposes. And then additionally for board consideration, on top of that would be what duties are allowed to take place when a provider is not present. In terms of the recommendation, grant waiver to permit the health center managers and health center assistant managers to have the key to the drug cabinet for inventory purposes for 5 years, or open it up for board discussion.
So the ask is to permit the health center managers and health center assistant managers the key to access the secure medication area for inventory purposes, period. But you mentioned and other purposes. What does other purposes mean?
So that ties into the follow-up questions that we had asked, and piecing together the implications with the way the waiver was initially worded or the request was worded. So this would actually involve the second component in terms of dispensing. If, and I'll pull I believe I've got it up here. If delegated by another healthcare provider, one of the unlicensed staff would dispense certain medications in the absence of a provider, and they would communicate via essentially a Zoom call. So the provider on one end that's present in one facility within the Planned Parenthood organization would essentially be responsible for all of the tasks associated with the judgment and determining that the medication selected is appropriate and is going to the correct patient, et cetera. So that would be the additional component.
In essence, we're doing, what's it called when you have a pharmacist? So you have a telehealth provider actually doing and are they eyeballing the actual item to be dispensed? And is all of the correct information, how does that get on the item to be dispensed? Is it already pre-made where Ask the patient's name, the med, all the stuff you're supposed to have on those things.
Staff member Onion, when asked what providers would be providing or supervising those services, we were given a list to include MDs and RNs, et cetera. However, I'm not certain if it would only be limited to certain providers, because I know depending on the type of provider, dispensing may have to be, may require it to be personally dispensed. And I know there is some subjectivity as to what that might mean in certain circumstances. In other words, it would be different from a physician as compared to a nurse.
Well, I'll open up, discussion. Remember Patel, you were first.
Board Member Patel, so I assume the manager and other personnel non-licensee, and therefore my answer will be still opposed. And but still, I would just consider what other activity. Board Member Chen, you bring up the right point. Like, what if it's a tele provider, and that means I don't know. Then who's going to supervise them? So
Yeah.
my answer will be no.
Noted, thank you. Board Member Hammond,
No.
Member Beeman,
Board Member Beeman, I'd like to hear further discussion before I weigh in.
Board Member Chen, I would really like to have more information from Planned Parenthood on I'm not able to picture a non-licensed person pulling a prescription to dispense to a patient without more information about how is the prescription prepared, who's putting all of the information that needs to be on a prescription, making sure that the person who is on the FaceTime is viewing all of that in real time and able to see the prescription, and that they are a licensed person able to dispense. Because not everybody on that list of who works at Planned Parenthood is, well, I guess RNs in some health clinics can dispense, but they're under different protocols, if I remember. But that's not spelled out clearly here. Member Hall?
Member Hall, yeah, I would like to know, I would like to see a list, unless you already have it, of like what medications exactly they're dealing with. I mean, I'm imagining birth control pills and what else are they dispensing? Yeah, without more information of how the process is for the clinics, I mean, I'd be a no, but I would like more information. And I do have to leave early.
Member Kirkbride?
I mean, I can appreciate this area of Oregon and the importance of access to these services, but I am uncomfortable with the dispensing piece. I don't feel like their application was clear. I don't like that they said they don't have a med list. So if you're asking about, having access to meds and you can't even provide us with a list of what's in there, and you're doing inventory, but you don't have a med list. That seems questionable. And so I think if they're asking about a dispensing model, they need to provide a lot more details about what that's going to look like. So I would not support it as it is today.
Board Member Kroger?
Board Member Kroger, I agree with what Board Member Kirkbride said. While I'm sympathetic to staffing provider challenges, I think our board should have a bit more information and a better thought out request for us to feel comfortable with this waiver.
Board Member Pineda?
Member Pinedo, I am going to have to agree with other board members and not giving non-licensed staff access to medications. If they are putting them away, you still having access to medications with that. And
It's really the dispensing of medications that's the biggest issue. Which,
I know.
yeah.
I know.
Board Member Jones?
Yeah, board member Joyce, it's unfortunate because, I mean, they should have provided more details as far as what exactly they'll be doing. I mean, are they gonna be reconstituting any little vials of ceftriaxone for these patients? Are they, any reconstitution of even oral medications?
I think they're gonna do that.
Okay.
That would be an IM shot.
That would be, yeah.
Yeah.
Yeah, well, I mean, what about oral?
Got one for the manager to get.
Or even oral powders and liquid, and if there was a telezoom provider saying, hey, put 15 mils into this bottle, shake it up. They're non-licensed and they're handling these drugs and there's a certain process. We want to know, is there a clear visual of the medication by the provider through Zoom care and what steps are being taken? And are there controlled substances in this facility or this? Probably not.
So we didn't get a list of medications.
Yeah, so we don't know.
It's a brand name and this is Kirkland.
Gotcha. All right. Well, I mean,
It was via Zoom for doing that visit.
I will say, I want to support the area. I want to support Planned Parenthood. And unfortunately, we need more details.
Member Kirkbride, they did say no controlled substances,
Okay.
but they could
Thank you.
not provide a list.
All right, thanks.
Board Member Beaman, I'm coming back to you. You wanted to hear more conversation?
Thank you, Board Member Beeman. I appreciate the conversation, and I am a no on this one.
Is there a motion to move to deny the request as presented for Planned Parenthood of Southwest Oregon?
So moved, board member Pinedo.
Okay.
Second, Board Member Kirkbride.
Okay, so the motion is to deny. For President Shen, yes. For Vice President Joyce.
Yes.
For Member Beeman.
Yes.
Member Hall has stepped out. For Member Hemmons.
A yes means that we're voting to deny
Yes,
the
ma'am.
request?
Yes, ma'am.
Yes. Yes.
For Member Kirkbride.
Yes.
For Member Kruger.
Yes.
For Member Patel.
Yes.
For Member Pinedo.
Yes.
Motion passes with Board Member Hall being absent. Thank you. We have time to do one more, yes?
Bree, did you need to present executive session or something? This was the last,
It doesn't matter, either way.
this was the last item on our. It's up to her. I thought you guys had a request. Oh,
Let's go to the next agenda.
there isn't any, it's adjourning. This is the last item.
Oh.
So what, are we ready to adjourn then? Yes, ma'am.
You can go back into the first session.
Does she need to read that statement?
Yeah.
Okay,
I'll find the statement.
it's on the original, yeah.
You just let the public know that.
So, we're being requested to go back into executive
So
session.
we are not adjourning right now.
Need to find my,
Great.
I need to do that.
Ira.
So, Council Hunt, has asked if we could, go back into executive session. Great, so we've been asked to move into executive session. The time is now 4:31 PM. This executive session is held pursuant to ORS 192.660, para 1, para 2, or F para L, ORS 192.690, para 1, ORS 676.165, and ORS 676.175, which allows the board to meet in executive session to consider information or records that are exempt from law from public inspection. Representatives of the media and designated staff shall be allowed to attend the executive session. Representatives of the media are specifically directed not to report on any of the deliberations during the executive session, except to state that the general subject of the session is previously announced. No decision may be made in executive session. At the end of executive session, we will return to open session and welcome the public back into the meeting. Is there a motion to move to enter executive session for the purpose of legal advice, review and discussion of investigations and disciplinary cases at 4:32 PM?
So moved by Joyce.
Second, Board Member Beal.
Thank you. Board President Chin, yes. Board President, Vice President Joyce, Board Member Beeman,
Yes.
Member Hall is absent, Board Member Kirkbride,
Yes.
Member Kroger,
Yes.
Board Member Patel,
Yes.
Board Member Pinedo,
Yes.
Board Member Hemmons.
Yes.
Thank you. We'll wait till we get the,
Yes, so staff member Melvin. So for the board members who are on virtually, I'm going to open up the executive session Teams meeting from yesterday, and I will ping you and have you dial into that. So we're going to end this public call.
Thank you, Rachel.
everybody for being able to do this on the fly.